Hello, my name is Dr. Chet Khamare, and I practice cardiology here at St. Joseph's Hospital North. So a heart attack happens when an artery becomes blocked. And the analogy I often use with patients is if you think about a plant that doesn't get water, the plant dies. The heart muscle is very much the same way. If it does not get blood flow because one of the arteries in the heart get blocked, then that muscle doesn't get oxygen. Now, a question I get very often is, well, what are the symptoms of a heart attack and what are the things I need to look for as a patient so that I can make sure I get the care that I need at the hospital? And the most common symptoms we all know about are chest pain, of course. Some of the other symptoms you can have would be pain in your jaw, chest pain that starts in the chest but then eventually radiates into your left arm and hand, causing numbness or tingling. It is a very challenging diagnosis because there's different presentations for men and women. So years ago, there was a big push about educating women because the symptoms are so different. Now, some of the other things you could look for, especially for females, is nausea that's unexplained, getting really sweaty, feeling fatigued, lightheaded, or even getting to the point where you have a lot of vomiting. So the constellation of these symptoms together or even individually, if you have them, are critically important to get care immediately. You know, in business world, there's this old saying, time is money. So in cardiology, there's time is muscle. Kind of cheesy, but it's very, very true. The reason why we say this is the cardiac muscle is one of the few organs in the human body that if it becomes permanently damaged, it will not heal. Now, the heart has adapted to kind of work as a team, so the individual muscle cells, for example, can collectively help the heart heal, but once the damage happens, it's permanent. The reason why this is such a concern is there's a whole host of other medical conditions that can come about in a patient if they have a permanently damaged muscle. These would include electrical problems where they can have dangerous heart rhythms or heartbeats. Also, they can have what's called congestive heart failure where their heart is weak, so they start to hold water, which can lead to shortness of breath, even passing out, and a pretty poor standard of life because you can't really do as much as you used to do. So if they can get to the hospital quickly, I'm able to intervene quickly and open up this blockage. It really prevents a whole lot of damage to take place and allows them to recover much quicker.